Hi, everyone. I just wanted to come back today and talk about how to save money at the vet office. I've been working for several years, and I've been at the ER as well, at the animal ER. And, that's when I saw so many cases that could have been prevented with such a simple, preventative care, let's call it that way. One of those cases I still remember is a C-section. The dog needed definitely a C-section. If we didn't do a C-section, she was going to die, and the owner could not afford it, and it broke my heart. And he requested euthanasia. We had to put her to sleep, and I still remember that, and it makes me sick to my stomach. And that could have been prevented with just spaying the dog. Mm. One thing I strongly recommend is spaying your dog at before the first heat. Of course, there is some controversy about it. Now it's recommended doing it at the year mark or maybe 2 years of age. So now we are between the wall and a hard place because if we wait until she's a year or year and a half or two, she already went into heat. Therefore, she's already exposed to hormones, to estrogen, and that is going to make her prone to mammary cancer, mammary gland cancer, or breast cancer. Um, if we do it early before the first heat, well, now we are worried about the growth plates. And so I would say that if we're dealing with a small dog, like a Chihuahua, medium-sized dog as well, probably I would do it at 7 months of age. Hopefully, it's going to be before the first heat. Sometimes they go into heat at 5 months of age, which is unusual, but it's like in women, there are some little girls and 9 years of age and they have their first, period. In dogs, it can happen the same thing. But as a rule, I would say Chihuahuas, small breeds like that, they go into heat at 7 months of age. And large dogs can go probably 10 months and above, sometimes above 1 year. So I would strongly recommend spaying her. And as I said, the reason is breast cancer is very, very common in dogs that are not spayed. And the other reason is pyometras. Pyometras is an infection in the uterus, and that definitely, needs surgery, emergency surgery most of the time. And even like that, we don't know if the dog is going to make it or not. Most of the cases, they make it. But if she's already in sepsis, that means severe infection, in that case, that's my dog, by the way, that's my Malinois. So I strongly recommend your pet to be spayed when they are young. And if it is a small breed, probably 7 months of age. If it is a large breed like a shepherd, probably wait until it's 2 years of age or 1.5 years of age. Unfortunately, we got her already exposed to estrogen, so just she's always more prone to come up with breast cancer. Anyway, that for one side. So if that dog, going back to the ER case that I had to euthanize, unfortunately, if that dog would have been spayed, that problem would have been avoided and that dog would be alive today. And again, this is very, very painful for all veterinarians to have to do this. Okay. And again, I'm sure you and heard before that veterinarians are prone to depression, and sometimes even you know they kill themselves. I'm sorry, my Spanglish, it gets all twisted at this moment. I'm not saying I'm going to kill myself, okay, but I'm telling you that we sometimes we have to go through very, very hard moments and decisions that really throw us into very, very low places. Okay, so going back to how to save money. Okay, so the other thing is vaccinations. Parvovirus is very common. Parvo is all over. It could be in the doggy park. It could be at the vet office right here too. You never know. There could have been a dog that is completely healthy but is shedding the virus. Definitely it can be passing it to other dogs. Okay, so it's very important that your dog being vaccinated, and start as a puppy. It starts at 6 weeks of age, and we start doing every 3 weeks until they are 16 weeks old. Mm? The reason is mama's antibodies. If mama was well vaccinated, mama had antibodies, it has the defense. Therefore, that puppy, when it was nursing, it was getting all that protection. And that means that every time we give a vaccine, 6 weeks of age, 9 weeks of age, and so on, that vaccine, that those are viruses, by the way, they are viruses that are made nice. They are called modified viruses. So every time we give that vaccine, mama's antibodies come and neutralize the vaccine. So we try again. 3 weeks later, we do it again. By 16 weeks of age, usually those antibodies are gone. And the last vaccine hopefully will work. Now, there are some breeds, for example, Shepherds, Rottweilers. They are a little, pit bulls too, by the way, and they are prone to having a hard time to develop antibodies. Well, in those cases, it's recommended to go even one extra vaccine just to help develop that immunity. Okay, so if your dog only has one vaccine or no vaccine at all, and they come down with parvovirus, not only the puppy can die, but also the treatment is very, very expensive. It can range, let me tell you, in my experience with a puppy that we've been treating, it can be in the hospital for 3 days, 5 days. Your bill can go $5,000 or more. So we don't want to euthanize a puppy because the owner cannot afford it. Okay. So I had to remember because I wrote everything right here. Okay. So parasites, very, very important. Parasites are very common in puppies. They are very common in kittens. Most of them can go to humans and especially children. So be careful with that. They need to be dewormed every time that puppy or kitten goes to your vet or comes to us for a pediatric visit. We're going to be deworming. And the reason is every deworming will be killing the adult worms. If we are, talking about roundworms, hookworms. Now there are other kind of worms or parasites that we have to treat it with other medication, but the most common, parasites are usually roundworm and hookworms, and those are the one I was telling you that is very. If it goes to humans, it can be a problem. For example, roundworms can go into the eye. It could go into the brain because as soon as it enters the human body, it doesn't recognize as a host. Like, hey, this is, it goes into the bowel and say, okay, this is not a dog. I'm trying to be a little bit funny with that. But they start migrating, start going through the liver, start going through inside, goes into the eye, into the brain, and after that, they go to sleep, and the body attacks and makes like a shell, okay? And that can cause serious problems. So anyway, we need to deworm your pet. We need to do fecal tests once a year at least, okay? Very, very important. If your puppy or dog ends up with chronic diarrhea or vomiting because it has parasites, if he was dewormed or she was dewormed, probably you could have saved some money there, huh? The other thing, trying to avoid smoking around your pet. That can cause sensitivity in the airways and throw them into asthma or allergic bronchitis. So again, that's another something else that you can do in order to, increase the chances of having a pet that will live a long life. And, you might not have to come to the veterinary office very often. Very, very important. And this is my favorite subject. Teeth. Teeth, okay? So a few years ago, I would say 30 years ago, 25 years ago, you could have asked me, hey, Andrea, do I have to brush my dog's teeth? And I could have said, seriously, come on. Well, now we know that oral health is going to be completely related to the general health, just like in humans. If we have inflammation, periodontal disease, bleeding gums, that is going to cause inflammation in the liver, heart, even it can throw us into diabetes. So in pets, it's the same. We need to start brushing your pet's teeth every single day. That's strongly recommended. Do not use your toothpaste. Use just a regular toddler brush. You can get that in the supermarket. It's super inexpensive. But the toothpaste has to be one that is approved for pets. And do it every single day. And I'm going to tell you a story. If you might be thinking, well, there is no way my dog is not going to tolerate that. Well, when I came from Argentina, I had to do 1 year of internship here. It wasn't a residency. It was an internship in one of the universities. That's in Tuskegee, actually, Tuskegee University in Alabama. And they had greyhounds. Those greyhounds are blood donors, and they have to be very, very healthy. And they brush their teeth every single day. And let me tell you, it was so fun just to see them. As soon as I grab a brush, they will sit and they will do like this. And it's incredible. So if those dogs did that, they are so used to it and they are so easy to brush, your dog or your cat can do the same. But it takes consistency every single day until they get used to it. If you put something yummy, like for example, peanut butter, for example, on the brush, and do it every single day, let me tell you, your pet is going to be looking forward to 5 p.m. Oh my goodness, it's coming, mama's coming, or dad is coming with a brush. They will be looking forward to it. Now, don't be pushy, okay? Don't try to just shovel that brush like that, because if not, your pet is going to break up with you. So you don't want that. But even like that, even brushing their teeth every single day, they do need a dental cleaning, just like we do need it to. We go to the dentist every 6 months for a dental cleaning. Okay, your pet at least once a year needs to have a professional dental cleaning. Doing it without anesthesia, like for example, completely awake, there's no way it's going to work. So what needs to happen is once a year we need to, anesthetize your pet. Of course, we're going to place an IV catheter. And let me tell you, every veterinarian will be doing that. And if you have any doubt, ask them, okay? But they are going to have an IV catheter, they are going to have fluids, they are going to have general anesthesia, intubation to protect the airways. And, we do full mouth x-rays, making sure that we don't have any infection. We discover a lot of infections when we do x-rays. Now, without x-rays, we missed a lot. But anyway, so we do the cleaning, we put a sealant, we wake your pet up and ready to go home, okay? And I understand that some, pet owners are very, very worried about anesthesia. And let me tell you, anesthesia is very safe nowadays. I would say that probably 1 in 3,000 might die during anesthesia. I would say that your pet might have more chances of getting hit by a car rather than dying during anesthesia. So I strongly recommend you just, feel a little bit more relaxed about the anesthesia and let your veterinarian do a dental cleaning. Again, that is going to make your pet probably live longer, but also make you save money, because all of a sudden your dog is coming with a draining tract because of a dental infection. That is very common, by the way. So let's see if I'm forgetting everything. Oh my goodness, yes, there is a good one here. Do not let your pet ride in the back of your truck. We see so many accidents happen. Please don't. Please don't. Okay. We had several patients coming that being either dragged by accident in the back of the truck, or it just fell. And I cannot tell you, I don't want to even go over the details about that. Okay. Please don't do it. Do not let your cat going outside. That's another one too. When they go outside, they fight with cats, they fight with wildlife, they end up with abscesses. They might not show up home anymore. They might be hit by a car. Please, please keep your kitty inside. I know if he's already going outside, probably he's going to throw a fit and it's not going to want to go. But once you let him in, Let him throw a fit as much as he wants to, but eventually he will get used to it. And let me tell you, it's totally humane to keep him inside. Actually, they enjoy the safety of the inside of the house. Just have a nice big window. He can go there and just look at the birds, chirping there, and your cat will be completely, happy. So please don't let them go outside. I cannot tell you how many, cats come here with accidents that happen outside. Mhm. So again, I hope that all of these tips are helping you and everybody, saving some money. I understand that money is very tight right now for everybody, and nobody likes to spend money at the vet. And so please let's try to establish some preventative care. And let me tell you, a vaccine is very inexpensive. If you bring your puppy every 3 weeks until the 16 weeks of age, and after that, once a year for vaccine. So let me tell you, that is probably, I don't know how much is each visit. I don't have any idea, but maybe it's $150 every visit until 16 weeks of age. If your puppy ends up with parvovirus, you're going to end up, spending probably $5,000. If your dog is not spayed and ends up with a pyometra, she's going to end up with emergency surgery, very likely. And probably you will end up spending at least $3,000, $3,000. When the spay is how much? I don't know. It could be 600, 700, depending where you go. So please do the spay. Neuter is very, very important too. When dogs are at age of, start liking, girl dogs, they will smell a female in heat, probably even 3 blocks down the road. Sorry. As soon as you open the door, the dog is already out and is running and is getting hit by a car. If your dog gets hit by a car, you might not have a dog anymore. Okay. And if the dog is still alive, I cannot tell you how much it's going to be at the bill. Okay. At the vet. So please spay and neuter. Very, very important. Anyway, so I hope this helps. I hope it wasn't too much, and I hope my Spanglish is not too hard. I will try to come up every now and then with other topics and, and see, just to make it fun. Well, you have a great rest of the day, and I'm going to continue here at the urgent care shift. Have a good one. Bye-bye.